I think you raise an absolutely critical point. I mean, there is a massive syndemic that's going on right now where we've seen over the recent months a underdiagnosis in cancer, underdiagnosis or too few visits for severe cardiovascular events, issues in multiple therapeutic areas, ophthalmology, dermatology. And this is going to have a longer term impact on healthcare systems. The key right now is to get vaccination rates up. As we get vaccination rates up, even if COVID cases continue, they tend to not go to the hospital. They tend not to be as severe. And that will reduce the load on the hospital system. And hopefully then patients will get the diagnosis they need and ultimately the treatments they need. If I were to zoom in on cancer, the underdiagnosis in cancer means that patients are getting diagnosed later in the progression of their cancers. And it's much harder to get a really impressive result from any medicine when you're diagnosed late for a cancer. And so this is a significant concern. We're particularly focused on breast cancer, but also we see it in other cancer types as well. And I think this is something healthcare systems are going to have to contend with now in the coming 6 months, and companies like us have to do our part.
So here's the awkward question. Do you think that policy over the last year and a half has actually caused as many deaths as it's saved, i.e. policy of focusing on COVID-19 and getting vaccines there? Actually, because we've neglected other areas, and you mentioned one of the most important, which is breast cancer as well, actually we're going to cause a hell of a lot of deaths because we've taken our eye off the ball on these other ones.
Yeah, I think it's difficult to make these calculations. I think healthcare systems are doing the best they can. I mean, usually when you have acute illnesses like respiratory distress from COVID-19 infections, those will overwhelm hospitals and overwhelm healthcare systems. So I think healthcare systems had no choice. I think right now what's incumbent upon all systems is to get vaccination rates as high as possible, as fast as possible, and get patients comfortable to come in to get their diagnoses and treatments. We see a very good rebound in the United States right now, healthcare systems rapidly returning to normal. We've already seen it in China. It's happening now in Europe. And we just can't afford to lose that momentum, because I think if we go back to the place we were last year with mass underdiagnoses of chronic diseases, that will create a significant healthcare crisis for years to come.
Vas, as the fog of war clears ultimately, and hopefully we do get the other side of the global pandemic over coming months, what next for you? You mentioned to us, I think, back in Q4 that M&A was not the focus now. But do you think this period, the last 12 months, has perhaps flagged up some gaps in your current portfolio offerings? Are there any products or companies that you'd be interested in acquiring at this stage?
It's interesting, you know, what we see right now is we have such a full portfolio pipeline of medicines, partly that were in-licensed over past years, some of our new platform technologies. We have one called radioligand therapy that has had a very positive result that we'll fully release in June. We've had continued progress in our cell and gene therapies, as well as our broader pipeline. Our focus right now is on execution. We think coming out of the pandemic, there's an opportunity for companies that come out with very strong momentum as healthcare systems return to normal to differentiate themselves, both from a business performance, launches, as I've discussed, also on pipeline delivery. We've been able to manage through the pandemic and have pretty minimal disruption to our internal R&D efforts. And so that's really where our focus on execution, get back to strong, steady growth. And like I said, opportunistic M&A when it fits either in our therapeutic areas or pipeline, but not the focus at the moment.